Now, our next speaker is Ms. Maha Helali. On the topic, she'll speak on the topic from center to community in intervention with people with autism. Dr. Hilali earned her Master of Special and Inclusive Education from the Institute of Education of University of London. In 1998, she and other parents established the Egyptian Advanced Society for Persons with Autism and Related Disorders, where she served as chairperson. In 2004, Dr. Hilali was chosen as the coordinator of the Education Center for Special Needs Education for All program of Unesco. Since 2008, she has been a member of the Partners in Inclusion Network concerned with the education of children with learning disabilities in the Arab region. She also co-established the Arab Network for Autism and has served on its board since 2009. From 2011 to 2018, Dr. Hilali served as the president of Inclusion International MENA region, and in 2015, she became a board member of the Egyptian National Council for Persons with Disabilities, representing parents of people with intellectual disabilities. She earned the British Council Social Impact Award given to UK graduates with distinguished careers. And in 2020, Egypt's First Lady also awarded Dr. Hilali's effort to advocate and serve persons with disabilities in Egypt. Since 2021, she has been the technical advisor to the Minister of Social Solidarity for Disability and Rehabilitation Affairs.
I founded the Advanced Society in 1998, and it was registered in 1999, and it's a parents' organization. 7 of the founders, 5 of us had children with autism, and this was why we focused mainly on autism. We were able to, in 1999, find a curriculum which we found to be suiting to what we were looking for. As parents with children with autism, we believe very much in the ABA, which is Applied Behavior Analysis. And we were looking for a curriculum that used ABA, but that was also using positive reinforcers with the children. And this is when we came across the ABLES, Assessment of Basic Language and Learning Skills. And I'm not going exactly as with what's written in the presentation. And anyway, the presentation will be sent to all of you. So the ABLES, what we liked about it, it was user-friendly. It was good for parents to use. It was good for specialists to use. And with the scarcity of specialists who understand and work with autism, it was like an answer to what we needed. It focused mainly on the age 3 to 8. So later on, we not only Arabized it, we localized it, and we changed the language part and we changed the academics part to suit the Arabic language. We also had to build for the age under 3, because we were getting, of course, children diagnosed younger and younger, and this was coming on with people learning more and more about autism. So our vision has always been that we live in a community that will accept and understand persons with autism and other intellectual disabilities especially. And our mission is then to not only advocate for the rights, but also to provide the services that will help them reach their utmost potential. We provide services mainly for persons with autism, persons with other developmental disorders, intellectual disabilities, language delay, mild cerebral palsy, behavior disorders, and learning disabilities. We very much work with a multidisciplinary approach. So all the specialists work together, the speech and language, the OT, and this is what happens inside Advance itself. And Advance is now having 125 students from age 3 to 38, almost, 38. So we have 14 classes. In every class, we have 9 to 12 students. Very early, when we started the family support, we were realizing, of course, that the parents need to understand more and more about the children, need to understand about how to work with them at home. As my colleague mentioned before in her presentation, the parents need to understand how to work with the problems that the persons with autism has. There are two main factors in autism. One is the delay in language and social skills. And the second one is the rituals. And part of the rituals are the sensory disorders that we face with autism. So parents have to understand this, because not more of the same is going to do it. No, you have to understand, you have to change everything around the child to meet the needs of the child. We started campaigns, and besides, we also have the Empowering Adults program. The Empowering Adults are for those who are older, from age 18 to 21. We work on finding them what kind of job will be best for them, but not all of them are accepted in jobs. We're still having this problem in Egypt in general for work for persons with disabilities, with all kinds of disabilities. The two disabilities that are easier to find works for are visually impaired or those with physical impairments, because usually they would have gone through education. Education in Egypt is free till university, so they can go into the university. So then they have a certificate, and it is, I'm not saying all of them find work, but it is easier for them to find work. The most difficult to find work for are the intellectually disabled, autism, and of course those with emotional disorders. I'm not going to talk about the programs we have, because this is not the main topic you are focusing on. We have other programs outside, for like the summer program, Life Skills, which is every Saturday. The respite care camps are really important for the parents, because then they get to have a break. And of course, we realize that with autism, there are always sleep disorders, and parents suffer a lot. I'm telling you as a parent, I'm a parent myself. So up till now, my son is 33, and we have a lot of autism nights when we don't sleep. So we started a campaign for autism awareness. And with this campaign, we started it in 2005, and we started to go from governorate to governorate. And the idea was to not only create awareness, but also we were trying to stop the move that the parents were moving from outside Cairo to try and find the services. So we realized that what would be easier was to create the services for them in where they are. So we would recognize and find one of the active NGOs that work with intellectual disabilities or developmental delays. Very rarely did we find anyone who worked with autism in the governorates. But then we would work with them, and we would give them the program that we worked on. Our program by then had grown. We had built it up to the vocational, not only age 3 to 8, but we've built it up until we reached the vocational and also employment. So with the campaign that's going from governor to governorate, I think we have only like 8 more governors to cover from the 27 governors of Egypt. So we have covered 19 governorates. So we also reach services and training in the 26 governors. We only have one governorate that we have not been able to work with. But what we do is we usually do activities for the Autism Awareness Month. The activities is to show the children at their abilities, not what they can't do. So we do sports, a sports gala, we do an art exhibition. We have a scientific conference, and the scientific conference always we talk about what's the latest in the field of autism, what the latest in the intervention, what is the latest in the diagnosis. And we have a parent seminar. We ask the parents what would they like us to talk about. We also do an annual inclusive conference, and the idea is that with inclusive education, our children also with autism will have a chance to be included with the other children. There was a law that was issued in 2018 in Egypt, law number 10, which is for the rights of persons with disabilities. And this law we're very proud of because it actually is very parallel to the CRPD, to the convention, and it does mention the right for education. And since then, there's been inclusion, but only for mild disabilities. And we're hoping that with the move and with people understanding more and the curriculum now being inclusive and with more teachers training, that we will be able to include more and more children with disabilities in the schools. These maps show the map of Egypt, and there are three main maps that we are proud of in advance. One of them shows our free campaign, the campaigns which we do for free. Then we go in all the governance in which we provide diagnosis and setting a program for the children. And as I said, we would have already allocated our partner in those NGO, in those governors, so that they would continue the work that we are doing. Whenever we have anything new, we do a new curriculum, we do a new application, we bring them in to be trained so that they are always up to date with what is going on in advance. The last one on the left is about an alternative communication system called Kalami, which we have worked and produced with money from Vodafone. And it works very much with like the picture exchange communication system, which is you exchange pictures instead of words for those who are nonverbal. And there are like at least 40 to 60% of persons with autism who are nonverbal. So this is an alternative method. There are many communication applications in English, but this was the first one in Arabic and the first one in Egypt anyway. Okay. These photos will show you when we go down to the governors and what we do. We usually ask that the partner NGO takes in all the applications for people who want their children to be assessed. And then we set a time and a date and our staff go there. And the staff then get to do three things. Mainly, they give, as you can see down in the picture with the lady standing talking, this is one of our specialists. She's the head of the speech and language department. And they give lectures to the parents and mainly on how to communicate with the children and how to do verbal behavior and try and motivate the children to talk. Of course, you can't do everything at one time, but then we have the partner NGOs who will then continue with what we would have left for them. And the other thing we do when we go is that we start seeing the children one by one, and every child has an assessment. There are 3 specialists who see him at least, and then there's a program which is set. And then the program, we follow up with the NGO and we ask for the reports on the case, on what's happening, so we can tell how is it going, and if there are any problems, the NGO can get in touch with our specialists and talk to them and find out what to do. Okay, so as we said, training, and then we specifically work with the children. Parents' awareness is very important because, as we all know, the parents continue God willingly in the children's life more than anybody. And without training the children, the parents, the children will not benefit. The parents will not be able to work with them. And even if they don't work with them, they will not know what kind of services the children need, and if those who are giving the service are qualified to do this or not. It really, the need is very high. And this shows photos from some of the governors that we have gone to and the villages. It can tell you how much that even the WHO estimate of 1 out of 160, I don't think is realistic. I think if we go with what the last figure in the UK was 1 out of 55. we can take something in the middle. It is not going to be less than 100. There was one study done lately in Egypt in 2020 in the National Research Council, and they estimated that it's 1 out of 100. So even if we go with this, Egypt is a highly populated country with 104 million, so the need is very high. These are like examples of the case studies. This is one of the kids that we saw, young one, Anas, he's 3 and 6 months. So he wouldn't communicate, he moves a lot. We had to use with him reinforcement. We explained to the parents how to use reinforcement and the pairing, of course, before any work. And it's all done through play therapy. The result was, after the work, is that there was a development in the auditory attention. He could understand more like a near voice, a far voice. The visual attention was better. That was the young child. Habiba was 8 years old, and her problem was more in the academics part. By then, the parents are really focusing on the academics. Even if the child is not ready, they only can, because they want to put them in the school, and children with autism can go to school with a support teacher in Egypt. So they push, sometimes they push when the kid is not ready. But anyway, Habiba was reading with the Gestalt method. So she was reading, not decoding the sounds, but actually reading sight words. And the writing and the social interaction. So this was the focus. The result was the child developed the ability to write her name. She was able to read more than 50 words, 3 to 4 letter words. And she was able to match them with their pictures, which means that she's understanding them, not just identifying. She could recite the names of the months, the year, the days of the week. She could tell time. And this means that she was, progressing.
Dr. Helali, you have 1 minute.
Okay. So in short, this is what we have been doing till now. And this is how we've tried to reach what we're doing at the center, that it reaches the village. And we will be looking into working more with the CBR method, which we have not really worked with before. We took training last August with Dr. Ala in Jordan, Dr. Ala Sabia. And the idea was to understand more the CBR and to understand how we can help more. The numbers of persons with autism is increasing. The need is high. The specialists are rare. So we need to work more with something that is more feasible, that can be done. Thank you very much. And it was my pleasure being part of this webinar.